I just wanted to flash back 20 odd years to when I used to come up. And from our perspective, Becky and I used to love coming up and seeing Annie and you, because and Annie always made sure that we got to see you, and there was obviously a reason for that, which we'll pick in a moment. But I just think it's great. So I was coming up in 2000 initially, so 23 years later, we've ended up doing some work together, and I think that's pretty cool.
Yeah, it is. Yeah.
Yeah, but I'm trying to think back what it was about you that was different. And I remember one thing. I remember a couple of things. I remember you talking about your chef days. That was interesting. But what got us, I think, was one simple thing that I can remember. You went out and met people where they were. Whereas most of the practitioners we met, people had to do the work and get to the office, et cetera, to see the person, which was difficult for some people because they were so bloody nervous and cut off and isolated and things. But I remember that was the thing that really struck me. And obviously you said a lot of things that rang bells with us. And remember, I was pretty naive at that stage, having coming out of neuroscience. It was all a new adventure for me. And of course, there were advantages to that because I just looked at it with a fresh look and used my common sense and a bit of humanity. But so what were your impression of those early days, if you remember anything?
Well, they were interesting days because I'd kind of come into it as someone who obviously wasn't conventional in terms of, either doing services or managing services in that sense. So finding a space where you could be whatever, long hair, non-suited, obvious drug using past, irrespective of whether that was problematic or not, inverted commas, and we might come back to that. So finding homes was always difficult, but you also realized that you didn't fit into the system. The system then still recognized people as, if you weren't somehow a CPN with a footprint that had been in the background of potentially even Victorian institutes in our country, but psychiatric inpatient care, you weren't necessarily recognised. And what you certainly weren't recognised is, and that was the most interesting bit, is you weren't recognised as a professional, and that was the interesting bit. Even though I'd got by then I'd got a social work qualification and I'd got a master's in alcohol study and all the rest of it, none of that was deemed as being professional compared to having a medical background. You were still and then the other thing by then that was already different was, you have to remember that my first job, and in many ways it was the only job I could get after about 7 or 8 different interviews. In many ways, the only person who was almost prepared to give me a job, and my first job, was of course Ian Wardle at Lifeline.
Yes, of course.
The great Ian Wardle at Lifeline. Of course, so Ian, being in recovery himself, running an organisation that was full of people much closer, whatever expression we want to use, but to the edge or something, rather than, and he did employ people with all sorts of professional backgrounds, but they also had interesting human backgrounds. And so I'd already learned from that experience and time with Ian that actually part of the deal was actually trying to challenge the system as well as working with it. So I guess those are some of the things that you'll have come across, I think. And I did just like to practice that bit, both as a practitioner, but by the time you met me as a service manager as well, in which I just expected to be out there and getting and meeting and talking to people, rather than the notion that you managed from an office, looked at the numbers on a spreadsheet. None of that made any sense at all. It was meaningless. So I think there's a combination of all of those sort of things going on, really. And it wasn't easy, I have to tell you. There was a definite moment in and around that time when I was in one particular meeting when the two heads of the statutory drug and alcohol service, in a meeting with other people in the room, like police and other partners, I think it probably was a very early equivalent of this community drug and alcohol action team type things that the Welsh government set up. They actually just publicly in the meeting said I wasn't qualified to comment.